Good evening. Thank you for joining us tonight for our 18 News digital exclusive State of the Virus. Now, as cases of COVID-19 continue to rise across the country, 18 News is giving you, our viewers, an opportunity to ask local experts your questions regarding COVID-19. And today we're joined once again by Dr. Michael Scalzoma, Chief Quality Officer for Guthrie. Thank you for joining us, Doctor.
Thank you, George.
All right, so we're continuing to see more cases of the virus in our community. Chemung County, a majority of the cases are listed as hospitalized, and Steuben County continuing to report several hundred cases. So what is the state of our virus here in our area, in our hospitals, and how are you guys in the hospital handling it?
Well, George, you're right. Unfortunately, we are still seeing significant spread in the community and a larger number of cases. We had hoped that it was going to slow down a little bit, but unfortunately with the holidays, it does not seem like it has. The hospitals are very busy. Hospitals are seeing many patients. It's the same type of patients we've been seeing all along, those that are older and with other medical conditions, but unfortunately the number of patients in the hospital continues to rise.
All right, and what kind of condition are these patients coming in? You're saying mostly older, and they're having some, or they have probably things such as diabetes or other things that may have caused other issues. So what kind of state are they coming in as, and how long are they typically staying at this point?
Well, many of these patients are quite ill, and you're right, they often have underlying conditions, diabetes, hypertension, or other challenges, but they're staying sometimes 2-3 weeks in the hospital, which really puts a stress on the system. Unfortunately, some of these patients are dying, and we do see that because they are elderly and have other conditions. We really need to slow the spread in the community so that we can protect these individuals from having to be hospitalized.
All right, and in the hospital, PPE was one of the big issues early in the pandemic, not having enough masks, gloves, and gowns. How are you guys on PPE and some of the other equipment that you need to handle this rising patients?
George, that's a really interesting question. First, we're doing fine from a PPE standpoint. We do have adequate supplies, but what has happened over the course of the last 6 months has been fascinating. Back in the spring, our biggest challenge was sometimes having adequate PPE. And then as we moved on a few months later, the biggest challenge was testing. Did we have enough testing? And now, of course, we're focused on having enough space in the hospital and vaccines. And when can we begin to get vaccines out to the community? So the challenges we face continue to evolve. It has been a challenging and interesting time, but currently from a PPE standpoint, we have adequate to protect our staff and take care of the patients that we're seeing.
All right, so last week, the doctor and I talked about the new UK virus strain and how the current vaccine should be effective against it. We now know that it's in New York and it was detected in Saratoga. So what do people need to know about this new strain and how the vaccine is going to work against it?
Yes, the new strain is very interesting, and that even as recently as a week ago when we spoke, we weren't sure if it was truly more infectious. It really does now seem to be a more infectious strain based on what's happening in the United Kingdom. So it's not surprising that these mutations occur or that they've reached New York State. We expected that this would happen. What we do believe is it's not a strain that's making people more ill. And we do believe that the vaccine will still be effective against this. The vaccine is designed to produce a response against many parts of the virus, many parts of the spike protein that you see on the viral capsule. And so having subtle changes does not impact the success of the vaccine in preventing the disease. So we're optimistic that the vaccine will still be effective.
All right, that's great to hear. Now, earlier this week, the governor mandated with the vaccine that the hospitals use 100% of the vaccine that they've already had allocated, or else they could face a fine or even be withheld from further doses. Now, earlier today, he said that the allocation, that hospitals are using about 3 times as much per their staff as they were before. So how are you guys handling this new rule that you need to use all of the vaccine that you already have?
Yeah. So it's again an interesting challenge as these guidelines change. What we're doing is we're just reaching out more broadly. Now that we've been able to vaccinate our own healthcare system and those closest around us in emergency services or other indicated populations, we're just branching out a little further, contacting more individuals that are in the appropriate phase, that are still phase 1A, but perhaps group homes, other emergency workers, so that we can use that vaccine completely. and do as the governor asks and as we all want, get more people vaccinated quicker.
All right, Doctor, we're going to go to our first viewer question. This one is from Michelle in Tyrone, and she asks, now that the governor has included personal care attendants in Group 1A of the vaccination, where are people going to be able to get the vaccine? So first, the 1A people who are able to get it, where are they going to be able to get it? And in the future, when people, the general public is going to be able to get it, what are those options going to be for them?
So at the moment in New York State, in our region, most of the sites where the vaccine available is at the hospitals. So that the local hospitals would be the first point of contact to ask about whether they have appointments for vaccine administration. There is a system where these individuals can schedule an appointment through their organization. What we do know is that we are now ordering vaccine for our ambulatory offices, so for physician offices across the state. We don't have that vaccine yet available to us, but we're in the process of ordering it, and we expect that that will be shipped sometime soon. And whether that's next week or the week after, we don't know. Things change rapidly, but at that point, there will be more options for where people can get vaccinated.
All right, we have another viewer question. This one a little bit more specific. This viewer says that they're being treated for a Bartonella infection, and will it be safe for them to get a COVID vaccine? And we've talked before about how different conditions may prevent people from getting the vaccine. So what can you say about this one?
There are very few conditions that would preclude somebody from getting the vaccine. We do know that if you have active COVID, you should wait until you're done with the quarantine period and no longer are able to be infectious and be recovered from the disease before getting vaccinated. But as far as other medical conditions in general, there are not a lot of contraindications to being vaccinated.
All right, that's more great news to hear. And we have another viewer question, someone asking about the vaccine again. Can someone who has been vaccinated still carry the virus and expose it to someone else who has not been vaccinated?
So this is a really interesting question. And there's several parts to it that I'd like to respond. The first is studies on all vaccines begin on trying to prevent disease. So the first thing that's studied is the individual becoming ill after being infected with the virus. The idea of preventing transmission is secondary. That's something that gets studied as we learn more about it. What we do know is that there's a theoretical chance that someone could be exposed to the virus, be vaccinated, make a response to fight off that infection, and yet still have a short window of time where they could be contagious. We also know that no vaccine is 100% effective. So someone could be vaccinated and could still get infected with COVID and be able to transmit that. So in short, it's probably not common, but it's possible. And that's part of the reason why people still need to remain socially distanced and wear masks and all the other precautions we've been talking about for a number of months.
Absolutely. And we have time for one more viewer question. And this one is from Michael in Horseheads. And he asked, with the increase of the COVID-19 vaccinations, why has there been no information about the slope of spread? And Doctor, I would believe that's because, as we talked about, only a limited number of people have been inoculated thus far.
That's right, George. So there's two parts to that as well. You're right. So only a small number of people have been vaccinated so far, mostly those being those in long-term care facilities and healthcare workers. But it also takes a little while for the vaccine to be fully effective. So the full effectiveness of the vaccine is probably 1 to 2 weeks after the second dose. And we're just beginning to give the second dose to some of those workers at the end of this week. So it will be a few more weeks before even those individuals are significantly protected. And then more people in the community have to be as well. So it's both the spread of the vaccine, and there is a little time it takes before full effectiveness after you've received your first and second dose.
All right. Doctor, earlier we talked a little bit about what's happening in the hospitals and these rising number of cases. What do you need the public to know right now? And what do they need to know as we start this new year?
So I'd say most importantly that the vaccine is really the biggest tool we have in our toolbox to try to change the course of this pandemic and really improve everyone's life day to day. The vaccine is safe and it's effective, and we need people to be willing to take the vaccination. And I understand that generates a little anxiety, but it is much safer than being infected with a coronavirus. So I really want to encourage people to understand, to trust that the vaccine is safe, and to proceed with getting vaccinated when it's available to them.
All right, well, Doctor, thank you again so much for joining us. And of course, viewers, if you have a question regarding COVID-19 that you would like one of our local experts to answer, you can email us at news@wetmtv.com. And we'll have more on the fight against COVID-19 on 18 News and mytwintiers.com. Thank you for joining us and have a good night.